You've spent 40 years saving for retirement, but there's one cost that could unravel everything you've built, and it's the one most people refuse to face until it's already too late. Charlie Munger understood something most financial advisors won't tell you. The greatest threat to your retirement isn't market crashes or inflation, it's health care. The slow, relentless drain that starts small and grows exponentially just when you have the least ability to absorb it. This is The Rational Retiree, where we explore timeless financial wisdom for those who've earned the right to finally rest. Before we continue, nothing here is financial advice, just reflections on principles that have stood the test of time. If this resonates, leave a comment sharing your biggest concern about retirement health care and subscribe so we can continue this conversation. Here's the question Munger would want you to ask. Are you planning for the retirement you hope to have, or the one you're actually going to live? Because hope is expensive, and in healthcare, it can bankrupt you. Charlie Munger died at 99 in November 2023. He lived nearly a full century and watched healthcare costs transform from a manageable expense into what he called a national disgrace. He didn't just observe this as an investor. He lived it. He saw friends and family crushed by medical bills that no amount of careful planning had prepared them for. Munger never sugar-coated reality. He believed rationality required looking directly at the hardest truths, and healthcare scared him, not for himself, but for everyone else. For the millions who did everything right and still found themselves one diagnosis away from poverty. Here's what Munger understood that most people don't. Healthcare isn't just another retirement expense, it's a category unto itself because it's both unavoidable and unpredictable. You will need health care in retirement. The only question is how much and when. That uncertainty makes it the single most dangerous variable in your financial plan. The numbers tell a story that should terrify anyone approaching retirement. The average 65-year-old couple needs approximately $315,000 in today's dollars for health care throughout retirement. If you develop a chronic condition, diabetes, heart disease, cancer, that number easily doubles. If you need long-term care, it can triple or quadruple. These aren't worst-case scenarios. These are common outcomes. And here's the cruelest part. Healthcare costs rise faster than inflation, faster than investment returns, faster than Social Security adjustments. Every year, the gap widens. Every year you get older, need more care, pay more, and your savings deplete faster. Munger saw this as a failure of basic mathematics and basic humanity. But he wasn't interested in complaining. He was interested in solutions. And his solution came back to fundamentals: radical honesty, extreme preparation, and the courage to face reality before reality forces itself upon you. Let's get practical. If you're in your 50s or 60s, you need to run the numbers. Not the optimistic numbers your advisor shows you, the real numbers, the brutal numbers. Because by the time you're 60, the margin for error is gone. Start with Medicare. Understand what it covers and, more importantly, what it doesn't. Medicare Part A covers hospital stays. Part B covers doctors and outpatient care. Part D covers prescriptions. But here's what most people miss. Medicare doesn't cover dental, vision, hearing aids, or long-term care. And even for what it does cover, there are gaps. Deductibles, co-payments, co-insurance that add up faster than you think. Munger believed that understanding complexity was a moral obligation. If you're going to retire, you need to become an expert in your own healthcare costs. You need to read the fine print, understand your coverage, know what you're paying for, because ignorance in healthcare doesn't just cost money, it costs years of peace and security. The biggest healthcare expense in retirement isn't the predictable stuff, it's the catastrophic stuff. The stroke requiring months of rehabilitation, the cancer diagnosis demanding treatments not fully covered, the cognitive decline requiring memory care at $7,000 a month. These expenses destroy retirement plans, and they're far more common than anyone admits. Munger talked about preparing for the big disasters. In investing, that meant holding cash reserves. In retirement, it means building a financial buffer specifically for healthcare catastrophes. Here are the moves Munger would advocate. While you're still working, maximize health savings accounts. HSAs are the single best retirement vehicle most people ignore. Triple tax advantage, deductible contributions, tax-free growth, tax-free withdrawals for medical expenses. In retirement, when healthcare costs explode, having dedicated money you can draw without touching your IRA is invaluable. In your 50s, buy long-term care insurance. Do it now when it's affordable and you qualify. Don't wait until your 60s when prices spike or you're denied coverage. This is your window. Approaching 65, research Medicare options a year in advance. Talk to people already on Medicare, learn from their mistakes, understand which doctors accept which plans, which hospitals are in network, which drugs are covered. Missing enrollment windows can cost you permanently. Already retired, audit healthcare spending annually. Look at what you actually spent versus what you budgeted. Be honest about new health issues. The tendency in early retirement is to underestimate future needs. Don't bet on being the exception. Build healthcare-specific reserves. Keep an emergency fund equal to at least 1 year of maximum out-of-pocket expenses under your plan. Healthcare emergencies don't wait for mutual funds to recover. They demand immediate payment. Assume 5 to 7% annual growth. Don't budget healthcare at general inflation rates. It rises faster. Plan accordingly. One of Munger's core tenets. Survival beats brilliance. Build redundancy into your plan, Medicare, supplemental insurance, health savings accounts, emergency reserves. When something goes wrong, and it will, you don't lose everything. Here's something else. Stay as healthy as you can for as long as you can. Exercise, diet, sleep, stress management, these aren't just wellness tips. They're financial strategies. Every year you delay serious health problems is a year your savings last longer. We need to talk about long-term care because it's the nightmare scenario most people won't face directly. Long-term care is care you need when you can't perform basic activities, bathing, dressing, eating, toileting. It's not medical care, it's assistance with existence, and it's phenomenally expensive. Private nursing home, over $100,000 per year. Assisted living, $50,000, $60,000 annually. Home health aides, $25, $30 per hour, and Medicare doesn't cover it. Neither does standard health insurance. Here's the statistic that should keep every retiree awake. Approximately 70% of people over 65 will need some form of long-term care, not 10%, not 30%, 70%. Average duration is 3 years, though many need care much longer. Do the math. 3 years in a nursing home at $100,000 per year is $300,000 on top of all your other retirement expenses. Munger would say, if you don't have a plan for long-term care, you don't have a retirement plan. You have wishful thinking. Some people plan to rely on family. That can work, but be realistic. Caring for an elderly parent is exhausting, draining, and often incompatible with employment. If your plan is for your daughter to care for you, have you asked if she's willing? Have you thought about what it costs her in lost income and career opportunities? Others plan to spend down assets until they qualify for Medicaid. That's legitimate, but understand what it means. Impoverishment, less than $2,000 in countable assets, restrictions on care and services, giving up control. There are no easy answers. What Munger would say is, face it now. Run the numbers. Have the conversations. Make a plan. The people who suffer most aren't those who couldn't afford to plan. It's those who could have but chose not to because it was uncomfortable. There's a conversation you need to have before you retire, and it's not about investment returns. It's about end-of-life care, what you want if you become seriously ill. Whether you want aggressive interventions or comfort care, who makes decisions if you can't? How much of your savings you're willing to spend to extend life versus preserve inheritance. These conversations are uncomfortable. They feel morbid. But Munger would tell you that avoiding uncomfortable conversations is how people end up in situations they never wanted, spending money they didn't intend to spend, receiving care they didn't want. Get your advance directives in order. Establish health care power of attorney. Have explicit conversations with your spouse and children. Revisit them regularly because your views may change. One of Munger's most powerful observations, the system profits from ambiguity. When patients don't know what they want, when families are unprepared, that's when healthcare spending spirals. That's when life savings get drained in final months, not because anyone wanted it, but because nobody was clear about what they didn't want. Clarity is a gift. To yourself and to your family, Munger lived to 99. He experienced almost every health challenge a human can face. He lost an eye to botched surgery. He dealt with chronic pain. He watched his body slowly fail him. But he remained intellectually active and emotionally grounded until the end. One reason he could do that? He'd prepared. He'd thought through scenarios. He'd made plans. He'd had hard conversations. So when health crises came, he could focus on dealing with them rather than panicking about finances. That's the gift of preparation. It doesn't prevent bad things from happening. It ensures that when they do, you have the resources and resilience to handle them with grace. Let me tell you what Munger would want you to understand about peace in retirement. It's not about having enough money to buy whatever you want. It's about having enough clarity to want only what matters. And what matters is time with people you love, freedom from anxiety, and the dignity of independence for as long as possible. Health care costs threaten all three. But if you prepare properly, if you save more than you think you need, understand your coverage, have contingency plans, have the uncomfortable conversations, you can face whatever comes with confidence rather than fear. Here's the final truth. You can't control how much health care you'll need or how much it will cost. But you can control how prepared you are. You can control your savings rate, your insurance decisions, whether you have a plan. In a world of uncontrollable variables, the things you can control become sacred. So control them, not because it's glamorous, because it's what responsible adults do. Because your 80-year-old self will be grateful your 60-year-old self cared enough to prepare. Because preparation is an act of love for yourself, your spouse, your children. Munger spent his life studying what separated successful people from unsuccessful. One key difference, the willingness to do hard things now to avoid catastrophe later. Don't be most people. If you're in your 50s, start planning now. If you're in your 60s, fill the gaps. If you're already retired, audit where you are and adjust course. It's never too late to improve your situation. And remember what Munger knew. Life is long if you're lucky, and expensive if you live it fully. Healthcare costs are part of that expense. They're not a punishment for aging. They're the price of staying alive. And staying alive is worth it. Your job isn't to eliminate healthcare costs. It's to prepare for them so thoroughly that they don't eliminate everything else you value. In the end, this is what Munger's wisdom really comes down to. Look at the hardest truth directly. Prepare for it rationally, then live your life without fear, knowing you've done what you could with what you had. That's not just financial wisdom, that's human wisdom. Thank you for spending this time reflecting on these principles. Leave a comment with your biggest healthcare concern. I read everyone. And subscribe to The Rational Retiree so we can continue exploring these truths together. Not with hype or false promises, but with the calm clarity that comes from decades of tested wisdom.